So that's my treatment approach for PCOS. That's polycystic ovarian syndrome. To understand that, we need to understand a normal menstrual cycle. So in a normal menstrual cycle, we have the menstrual phase, which is 1 to 5 days, the follicular phase, which is going to be 5 to 14 days, ovulation, and then we have the luteal phase, which is generally about 14 to 28 days. All right, so the menstrual phase is going to be when we have the shedding of the uterine lining and the menstrual period. Follicular phase, estrogen levels start to rise, follicle stimulating hormone is going to be released, and it's going to promote the growth of the follicles. We have one of the follicles is going to become the primary follicle, which is going to prepare to rupture between days 10 and 14. On day 14, we have a surge in luteinizing hormone and the rupturing of the follicle and the releasing of the egg. We then start the luteal phase, which is going to be when the egg is released from the ovary and goes into the oviduct, and progesterone levels are rising and preparing the uterine lining for pregnancy. Now, I want to note that this is the Cliff Notes version of the menstrual cycle. It's obviously much more intricate than that. All right, so luteinizing hormone and follicle stimulating hormone are very important as far as helping to maintain a normal menstrual cycle. And so you can see that these have to be released in proportional levels to each other to make sure that the cycle is running properly. And that's important to remember when we talk about PCOS. So there are multiple different factors that can contribute to the development of PCOS. However, one of the key factors that's believed to be involved is going to be hyperandrogenism, okay? And with this, we have an excessive release of androgens. And those androgens are going to be testosterone and dehydroepiandrosterone, which is also known as DHEA. All right, so what happens here when we have these androgens in higher levels than normal is they cause abnormal follicular growth and dysfunction of gonadotropin-releasing hormone. All right, so gonadotropin-releasing hormone, what it's going to do is it's going to promote the release of luteinizing hormone. So now we have excessive secretion of luteinizing hormone. So the excessive amounts of androgens and luteinizing hormone are going to suppress follicle-stimulating hormone levels, and this is going to interfere with the follicular growth. And now, because of these excessive levels of androgens and luteinizing hormone, we don't have that primary follicle start to grow and become the dominant follicle, and then it doesn't rupture and we don't have ovulation. So one of the things I like to incorporate in my treatment of PCOS is resveratrol. So resveratrol is going to be a very beneficial supplement, and what it's been shown to do is reduce testosterone, luteinizing hormone, and DHEA in women with PCOS. It's also been shown to reduce PCOS symptoms, and it's considered to be an effective therapeutic modality for PCOS. It also has really good anti-inflammatory effects, which is a contributing factor to PCOS. And that's what I'm going to talk about next.